And now that we're on patient setup, the second part that's essential for each patient is weighing the pieces of the table, or what we call weighing the table. And so you're only going to have to do this for the sections that you're adjusting as you go, and it's a quick process, but it's essential. And so we begin with the headpiece. So the first thing we have to do is set the table to dorsal. Make sure that this is ready to raise, and this is going to rise and meet you. And you want to warn your patient. Now, you come to the head of the table, and you take a few half turns until the table drops from the patient's bone weight of their head, and that's it. Then you take 2 to 3 half turns, and that's plenty of tension again in the table. The table's going to rise to meet you, so that all it takes is a finger weight adjustment, and that is it. Moving down from the headpiece, the next sections are the dorsal and the lumbar sections of the table, which, as we discussed, is the big knob with the metal bead on it. The side that the bead is pointing to is the side of increased tension. So by setting the table to dorsal lumbar, making sure to pull out the piece so that there's no air going to the headpiece, we step on the plate, and the dorsal and the lumbar pieces both raise. In order to set the appropriate adjustment after you raise the table, you're going to switch the bead away from the side that you want to drop, and then give it about 1/3 of a turn back to give it the appropriate tension again for a finger weight adjustment. Then you would switch again for the lumbar section. And because we had our patient move forward to situate her on the table appropriately for the adjustment, we're now going to have her move down the table and align appropriately with the pelvic block. Just a little bit more for me. Thank you very much. All right. Now, we're going to switch the table to the pelvic setting, and there's only a pelvic tension knob on the left side. So in raising the table and setting this, we need to come here. Decrease the tension until the table drops on its own, and again 2 to 3 half turns will provide enough tension. Finger weight adjustments, it's a quick setup, and there you guys go.